So here we'll be looking at the differences between two disease conditions that could be related to the pancreas. All right. So it could either be, okay, we are talking about insufficiency. So that means the things produced are not sufficient. Okay. So it could be endocrine insufficiency, it could be exocrine insufficiency. Now, endocrine, just like the way the word actually implies, endo is more of like what? Hormones. While exo is more of like what? Enzymes. You get? So the pancreas, we'll talk about this condition where we get to talk about what? We are trying to find out the differences between what? Pancreatic endocrine insufficiency and the exocrine insufficiency. But we get to discuss the pancreatic endocrine insufficiency differently. We get to see the concept. Then we get to talk about the pancreatic exocrine insufficiency also differently. So when you combine the two knowledge, you know the differences between the two concepts. Okay. For the definition, the pancreas has two main functions, which is basically what? The endocrine function or the exocrine function. All right. So for the endocrine function now, it produces hormones like what? Insulin, glucagon, somatostatin, which regulates the blood sugar levels, right? Then the exocrine now is it produces digestive enzymes like what? Amylase, lipase, trypsin. That's for nutrient absorption. Now let's talk about the endocrine first, which is basically having to do with these three main hormones, right? So what is the characteristics? If you are saying there's a pancreatic endocrine insufficiency, you are saying the hormones are not enough. So that means the hormones are deficient. You already know the hormones, right? So that means what? What is the function of the hormones now? To regulate blood sugar. So that means what? Blood sugar regulation will be impaired. It can lead to what? Disease conditions like what? Diabetes mellitus type 1, type 2, right? So it could lead to hypoglycemia or lead to what? Hyperglycemia. Either one could happen. All right. So what are the causes? It could be that the patient already has the type 1 diabetes or type 2 diabetes. Type 1, there is no insulin produced. While for the type 2, there's little insulin produced or there's insulin resistant. Okay. It could be that the patient has a pancreatic surgery where a part of the pancreas was cut out and all of that, right? Pancreatectomy. Okay, it could be that there's pancreatic cancer. So there's pancreatectomy. So that's why what the cancer is not the pancreas is not able to produce a lot of hormones like it used to. Okay, could be cystic fibrosis, could be genetic disorder, right? Symptoms could either be hypoglycemia, hyperglycemia, weight loss, fatigue, increased thirst, and urination. Treatment: you replace insulin, right? Replace insulin. Then, if the patient is hypoglycemic, you give some hypoglycemic medications. Then, diet and lifestyle modification. Of course, if the person has really had a surgery, you don't expect them to be doing their day-to-day activities like they were doing before. Right? If you're drinking, you stop. If you're smoking, you stop. And there are some foods that will basically what they will advise you to stop eating or continue eating. Okay. Now, looking at the exocrine insufficiency now. For exocrine, you are basically trying to look at what? The enzyme. Okay. So amylase, trypsin, protease, lipase. They are not there. They are not sufficient. So all these foods that you are supposed to act on, they will not be able to act on this again. Do you understand? To act on this food to release nutrients, do not be able to do that, right? So what could be the complications of what? Pancreatic exocrine insufficiency? That means the digestive enzymes are not enough. There will be malabsorption of nutrients because these enzymes will not be able to act on those, what do they call it? They will not be able to act on those foods to break it down, right? So there'll be steatorrhea too, that's fatty stools. There could be diarrhea, there could be weight loss, okay? Causes. It could lead to chronic pancreatitis, could be pancreatic surgeries like Whipple's procedures, could be pancreatic cancer, could be cystic fibrosis, could be Schwartzman-Diamond syndrome, could be pancreatic trauma. The symptoms include diarrhea, steatorrhea, weight loss, abdominal pain, fatigue, right? Treatment is what? Enzymes are not there, so replace the enzymes. Simple, all right? Then dietary modifications, then what? Vitamin supplements. Okay, so that's it, guys, for this and bye for now.